Bree. I'm student nurse Shelby.
Hi, I'm Brianna.
Can I have the S-bar for the patient you're about to go see?
Sure. So her name is Shanana O'Connor. She's a female, 34 years old, in room 231. Her allergy is trimethoprim sulfamethasone. She's a full code. Right now she is on a renal disease diet, which is a 1,500 milliliter food restriction, and her physician is Dr. Engelbert. So the patient came in with fever, chills, and general malaise. She's a type 1 diabetic since she's 8 years old, and she also has end-stage renal disease for 1 year. So the patient reports within the last month that she has increased blood glucose levels. The usual doses of insulin are not controlling her blood glucose. She also has a decreased appetite, minimal urine output, and it's dark and more concentrated, she said. A weight gain of 10 pounds, and she denies swollen and tender lymph nodes. A little bit of her history: she has renal failure secondary to diabetic neuropathy. She also has hypertensive nephrosclerosis. She's undergoing hemodialysis 3 times a week for the past year. She's listed for a kidney transplant 6 months ago, and she also has diabetic neuropathy, as we mentioned before. Her previous illnesses are graft infection 3 months ago, but it resolved after antibiotics, and she has a history of recurrent UTIs. So here's my assessment. The vital signs are: heart rate is 108, respiratory rate is 20, her O2 sat was 97%, blood pressure is 138/78, her temperature was 100.9, which is a little elevated. Her pain 2 hours ago was at a 4. Her current weight is 177, and she's alert and oriented times 4. Upon my physical exam, the skin was warm, intact, with mild diaphoresis. She has an IV right now in the right median vein. She denies pain, difficulty while urinating. Also, she has numbness, tingling in the lower legs, which is the diabetic neuropathy. The AV graft appears clean, pink, intact, with bruit and thrill present, which is normal. Some tachycardia with a regular rhythm, and a slight 1+ pitting edema in the lower extremities. So her current medications is calcium carbonate, a renal multivitamin, aspirin, clonidine, insulin, erythropoietin with the dialysis, atorvastatin, and today we're going to give her antibiotic therapy with the sodium chloride. So her lab results include her blood glucose, which was 210. That was at 5:45, so it's a little bit elevated. Her social history, she states she lost most of her friends, only has one close friend, so she has a little bit of emotional feeling there with her friends. For my recommendations, we should make sure that she continues her dialysis today per her regular schedule. This will help prevent toxicity with the medication we're giving. We're going to assess the IV site, make sure there's no swelling, redness, or any signs of infiltration. We're going to administer the IV antibiotic therapy. So the first we're going to do is the baseline, which is the normal saline. That's going to be her primary IV infusion. We're going to do that 30 milliliters an hour. And then we're going to do the IV piggyback antibiotic, which is the imipenem cilastatin, and that's going to be at 500 milligrams over 30 minutes. And she gets that twice a day, so every 8 hours. We're also going to educate the patient about the new medication, which we're going to tell her about the side effects, adverse reactions, everything she needs to know. Also the signs and symptoms of C. diff and superinfection. We're going to make sure that she reports this immediately to the doctor. We're going to continue to monitor her blood glucose levels. We're going to see if we need to call to adjust the sliding scale if it doesn't control her blood sugar, and check her daily weights. And we're also going to monitor her lab values like blood and creatinine because of her renal failure.
Okay, great. Why specifically is this client receiving this medication? What action does the medication have on the body?
Well, she's receiving this medication because her doctor suspects an infection. He ordered the IV antibiotic therapy while ruling out bacteremia or UTI because the patient has an elevated temperature with chills. The client reports decreased urine frequency and volume output, and that her urine has become more concentrated and darker. However, she denies pain, burning, or difficulty with urination. She also has the elevated blood sugar, as we mentioned, and decreased appetite, which these also can indicate infection. So the imipenem inhibits bacterial cell wall synthesis, and the cilastatin prevents metabolism of imipenem, resulting in increased urinary recovery and decreased renal toxicity. So we want to make sure, like we mentioned before, that she's doing her dialysis.
Okay, when should you question administering this medication?
We want to question it if they have a cross-sensitivity with penicillins or cephalosporins. Also, if they have a previous history of multiple hypersensitivity reactions, if they have any type of seizure disorders, renal impairment. However, you can give it to patients with renal impairment if they do have dialysis within 48 hours, so we can give it to our patient.
Okay, does the medication have a therapeutic serum level?
No, it doesn't have a serum level, but the peak is at the end of the IV fusion, and the drug duration is 6 to 8 hours.
What vital signs do you have to monitor?
We're going to monitor all vital signs while giving this medication. They're all imperative to her health. Also, the client has end-stage renal disease, so with her lab values, we're going to monitor her abundant creatinine.
Okay, what physiological parameters should be monitored when the medication is being administered?
Because the medication is used with caution in clients with renal disease, we need to ensure that, like we mentioned a couple of times already, that her hemodialysis is going to occur within 48 hours of her receiving the antibiotic. We're also going to monitor the skin around the IV site for any signs of infection or infiltration. Observe the patient for signs and symptoms of anaphylaxis, like rash, pruritus, edema, wheezing, anything like that.
Okay, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting or at home?
We're going to advise the patient to report any signs of superinfection, which is like a black furry overgrowth on the tongue, vaginal itching, loose or foul-smelling stools, and any signs of an allergic reaction, like we mentioned, rash, itching. Consult the healthcare professional before treating with an antidiarrheal. Report any pain at the IV site, any signs of infection at the IV site. We're going to caution them to notify their healthcare provider if fever or diarrhea occurs, especially if the stool contains blood, pus, or mucus. We're also going to observe the patient for signs and symptoms of anaphylaxis.
Okay, what are the side effects and potential adverse reactions?
So the main ones we're going to look out for is Clostridium difficile, and we're going to educate the patient on this. Pruritus, sweating, phlebitis at the IV site, and allergic reaction including anaphylaxis, like we mentioned.
Okay, and then how do we know the medication is effective?
So the resolution of the signs and symptoms of infection will let us know that it's effective. So with this, we're going to see the temperature go back to normal. The white blood cell count will go back into the normal range. Also, the length of the time for the complete resolution depends on the organism and the site of infection. So we can see how long it takes for the infection to go away.
Okay, great. Ready to go in?
Yes. Okay, let me get my stuff together here. Okay. Hello, Miss O'Connor. How are you?
Hello.
Well, I'm Brianna. I'm your nurse today. How are you feeling?
Great.
Good. Well, right now I'm going to start your IV. We're going to do your normal saline, and we're also going to give you an antibiotic, which is imipenem-cilastatin for your suspected infection. Okay. So before I do anything, I'm just going to assess your IV site, okay? But first, can you state your name and date of birth for me?
Shanana O'Connor, 34 years old.
Good. And any allergies?
I'm allergic to trimethoprim sulfamethoxyazole.
Okay. Now that doesn't interfere with anything we're giving you, so that's good. Let me just scan here. Okay. So first, we're going to just scan the normal saline. It's our bag here. So I'm going to do my first check, which is the 5 rights, right patient, right dose. So we're going to give this at 30 milliliters an hour, and we make sure we check the bag, check the expiration date, that it's clear, not cloudy, make sure we have the right amount. So it's 0.9% sodium chloride, which we got the right one. The right time, so it's given at 0800 and it's 0735 now. The right drug, which we said. And the right rep, which we're giving the IV. So we double checked everything. Okay. Okay, so let me just take a look at your IV site. Everything looks good, no signs of infection, no swelling, no redness, anything. Good, no signs of infiltration. Okay, so we're going to do our next check. Can you state your name and date of birth for me?
My name is Shanana O'Connor. I'm 34 years old.
Okay. So second check, the right patient, right route, which is IV. We're going to double check it here. Right dose, which is 30 milliliters an hour. We'll make sure we have the right bag, 0.9%. Right drug, sodium chloride. And the right time, which is 0800. Okay. Now we're also going to hang the IV piggyback, which is imipenem silostatin. So we are going to also make sure that we have the right patient. State your name and date of birth for me.
Shanana O'Connor, 34 years old.
Okay. The right route, which is IV. We made sure we check that with our order. The right time, so this is given at 0800 with the sodium chloride. The right drug, so we check the bag. So it says imipenem silostatin. So we make sure we have that. And the right dose. So we're going to give this 500 milligrams per 100 milliliters. So we checked everything. All right, so now we have the IV site assessed. You can go ahead and hang the sodium chloride first. Now we're going to make sure that this one is lower than the IV piggyback. We're going to turn this on. How are you feeling, okay?
Mm-hmm.
Okay. Just give me a second here, we'll set this up. So while we're letting that set up here, I'm just going to flush your IV, make sure it's patent, okay? So any pain while I'm flushing this?
No?
Okay, perfect. And it's flushing really well. No, no pressure or anything. Perfect. Okay. So first thing we're going to do is set up our normal saline. These are all put together here. So the end of this port and all of these ports are sterile, so we would normally have caps on these, and we want to make sure that they don't hit the ground and they don't touch anything else. So before we do that, we're actually going to prime the line. So you want to open the roller clamp and let some of the medication flow out. Perfect. Okay. All right, now we can put it in and we'll set this up. So we're going to select channel A here. We're going to make sure that half of this is filled, half of the chamber is filled. So now we'll set up our infusion at the rate of 30 milliliters an hour. And the bag is 500 milliliters. So we're going to enter both of those and press start. So now it's just going to check the line. Okay, so if it says occluded, we're going to take it out and make sure there's no air bubbles in it. You can kind of just hold it up and make sure that there's no air bubbles. All right, and we're also going to make sure that the roller clamp is open. All right, so once it turns green, we are good to go with that, and we're going to watch 5 drips. Okay, so we watched our 5 drips. So now we are going to hang our IV piggyback. I'm going to do one more check here. So we're going to do the right patient, which we checked before 3 times. The right route, which is IV, we checked. The right dose, which is 500 milligrams over 30 minutes. The right time, which is 0800, and right now it's 0735. And the right drug, imipenem psilostatin. So we just wanted to do one more check before we hang it. So this one is going to be higher than the primary. And also the end of this is sterile also, and we're going to connect this to the port closest to the pump. So we're going to connect that here. So now we'll set up our secondary. Okay, so we'll find our drug in here. Make sure we have the correct amount in there, 500 milligrams. And the rate we want to be at. So we're going to do. Okay, so we put in 30 minutes. So now we're gonna let the piggyback run. Make sure there's no air in the line. I'm sure it will tell us. How are you doing? Okay?
Mm-hmm.
Okay. All right, so we're gonna watch for our 5 drips. We're going to make sure the clamp is open, and also on both of these bags we want to make sure that they have their tags stating the date that it needs to be changed, the nurse's name, the date of today, the drug, and the dose. So we always want to make sure that they're on the back and on the tubing. So we're watching our 5 drips. Perfect. All right, so both lines are running. This is green, which means that the line is pat and everything is running. How are you feeling, Miss O'Connor?
Good.
Everything is okay? You're not in pain or anything?
Nope.
Okay. Let me just document what I did, okay? All right. Just wash my hands here. All right, so what I'm going to give you now is some information on the medication that we're giving you. So Dr. Engelbart wanted to put you on this because you have a suspected infection. So I'm just going to list some side effects, adverse effects for you. Also some information on C. difficile, which can be a side effect of this medication. So with that, you're going to have some foul-smelling stool, some diarrhea. So if you notice that, let us know and your primary care provider. Also, we're going to give you some information on a superinfection. With that, you can see like a brown fuzzy tongue, and you can see some of the side effects in here. So if you notice any of those, you're going to let us know immediately too. Okay?
Okay.
All right. So here's your information.
Thank you
All right.
so much.
So after looking at that, can you tell me what some side effects would be of C. diff or superinfection?
If I have very foul-smelling diarrhea, if I have black furry growths on my tongue, I think I would notice that and I'd want to report that.
Okay, perfect. Good. All right. So I just wanted you to know that. Okay, so do you need anything from us right now?
No, thank you.
All right, so I'm going to be back in about 20 minutes, so I'm going to check the IV, check your rate, make sure everything is still flowing smoothly. All right, so I'm going to position you back here. Make sure your call light is here, okay? All right, well, thank you, Mrs. O'Connor. We'll see you in a bit, okay?
That was great. Were there any pieces of pertinent pieces of information you reviewed before administering the client the medication?
Yes, so we checked to make sure the client would be receiving her hemodialysis to prevent toxicity buildup on the medication. Also, the client should be asked if she had a reaction to penicillin or an allergy because cross-sensitivity could occur. We also want to make sure a urine specimen is collected prior to administering the medication to obtain culture and sensitivity.
Did this information affect your decision to administer the medication?
Yes, you would want to call the physician if the client was not receiving her hemodialysis in 48 hours because of the renal impairment, but we probably wouldn't give the medication.
Okay, did this information affect how he would administer the medication?
No, it's only administered IV or IM, and the order was for IV. We also assessed the IV site, made sure it was patent, and it was, therefore we gave it IV.
Okay, perfect. Thank you so much, Nurse
You're
Bree.
welcome. Thank you.